Hey guys, Dr. John here, Chiropractic Health and Wellness, and we're going to talk about these lacrosse balls. So we've kind of talked about some of the things you can use the lacrosse balls for, but I just want to go through a few things because I see that some people at some of the gyms we're at, some of our patients, use them in a different way than maybe they're supposed to be used. So you can use just one lacrosse ball like this, and if you're going to use it, and one of the best things you can do is kind of get right in between your shoulder blades, right here, because there's a lot of muscles that go through here. And if those muscles are tight and they're pulling your shoulder blade up like this, your shoulder blade's going up and your ribs are kind of coming out like this. So the muscles will kind of spasm or get really tight to protect those rib heads. And so the idea is not to put the lacrosse ball on the rib heads and roll around on them, because that will make the muscles very, very angry. And so if you get on a lacrosse ball and you get on there and start rolling around and you're like, oh my gosh, that's like an 8 or 9 out of 10 pain. You're on a rib head and it's nerve pain and your body's telling you to stop it. So don't do that. So start the ball right up here at the very top of your trap, in between your shoulder blade and your spine. So here's your spine, here's the bone of your shoulder blade. So just really all you have to do is get it on your spine and then just barely roll it to the right if you're going to do the right shoulder blade. And then what we're going to do, a lot of people are putting it in socks and putting up against the wall or going up against the wall. None of that. You don't have to do any of that. You just lay flat on the ground, and what we're going to do is instead of rolling around on it, because if you're rolling around on a knot, just realize you're doing this. We want to feed that knot into the lacrosse ball and kind of break those tissues down. The foam roller is good for rolling around on this guy. Still with the foam roller though, we want to start here and kind of roll our way into here, and that will start to kind of draw blood supply, get the muscles loose, but the lacrosse ball is going to do the most work because it's rock hard, and when it runs into those knots, it's going to start flattening them out so that the muscle is pliable again. So we're going to start that ball, if we're doing the right shoulder, up in the top, lay down like this, and just get a little pressure. And all you're going to do is take your arm and sweep it over your head and touch the floor like this. If you can do that pretty effortlessly with the ball right here, good. That means that area is not all bound up, and it shouldn't be, especially that high. Now what you can do is slide up a little bit, so you're sliding and the ball's going down. Now you're in another area. And if you start to feel that tension, like right there, like now we can feel a little tension. Okay, if we go a little bit further, oh, we're on a knot or a rib head. Okay, back off. Then we back off, and we're just feeding this. So let's say this is like a 5 out of 10 kind of feeling, maybe some pain, some tension. Keep sweeping back and forth like this on that spot and feed into the area of the knot. So then after that, maybe now you don't feel much. You feel maybe a 2 or a 1 out of 10. Okay, so move further down. And now we get to a little more tension, but again, not an 8 or a 9 out of 10. We're looking for like a 5 or a 6, because we're not looking to make the muscle mad here. And so we're just going to go back and forth and sweep, sweep, sweep. And we can continue to do that all the way down the spine. And again, if you get on an area where it just doesn't seem like it's going away and it just keeps hurting and hurting, it's a rib head. And we should probably release that rib head for you, or you got to get that rib head to release. And if it's not working with the ball, that's a perfect opportunity to get in and get that adjusted, because we can rapidly release that. Then this is way more effective. Now, the single ball is way more pressure than the double ball. So if you take the double ball, you're spreading the pressure out, right? So you got 2 sides now, and your spine's running down the middle. So if the single ball is a little bit too much for you in the beginning, put 2 balls together. You can tape them together. You could get a double-sided screw and screw them together like this. Or you could just do neither and just have it like this. Same deal. Right down the middle of your spine, right at the upper traps. You can do both arms, or you can just do one arm, and you just keep feeding down the spine until you feel an area of resistance, and then you want to go back and forth. And if it takes you 20 reps to get that to loosen up, you got to do 20. And you don't want to keep moving on and force the issue. So that's a perfect way to get some of the upper shoulder and middle back kind of loosened up, get those tissues loose again, get those shoulder blades down. One other cool thing about the lacrosse ball, especially the double one like this, is everybody is tight on their lateral quads and their IT band. Unless your legs look like this, almost everybody's like this, and when you sit too much, these get way too tight, and so we can strip these out. And what I usually say is, take your foam roller first, loosen the muscles up with your foam roller, and just go inch by inch. And if you find a spot, again, back up, and then slowly feed into that to loosen it up. But after that, after you've kind of gone the length of here and it's starting to feel a little loose, then you go to the lacrosse balls. You don't want to start with the lacrosse balls because it's pretty heavy duty right off the bat. So then we move to these babies and we stick them right here because we're trying to capture your lateral quad. This guy right there. And so we capture that top of the kneecap right here. And again, we're not looking to roll along this muscle. We're going like this and kind of laying down. And that's why it's kind of nice to have these balls taped together or screwed together. And then what we're going to do is kind of get our pressure in there and pump the leg like this. And when you're pumping the leg like that, you are pulling the tissue fibers into the ball like this. And you're just going to slowly kind of unwind them and mash them out like this a little bit. And then you just work your way all the way up until all that feels pretty loose. And I guarantee you after you do that, when you get up, your knee will feel super loose. If you're squatting like this, it'll feel a lot looser. Anybody who suffers from knee pain and it's not a torn meniscus, any tendons that are torn, any ligaments that are torn, it's almost always that your patella or your kneecap is tracking goofy because your lateral quad and some of your hip flexor muscles are way too tight. This is an awesome way to loosen that up. Thank you very much.